I'm Von Biggs, and let's queer up health. New ADAP limits could strip HIV treatment from thousands of Floridians. Tonight we bring you a breaking news that will directly affect tens of thousands of people living with HIV across Florida. Florida ADAP, the AIDS Drug Assistance Program, has announced abrupt and sweeping changes to eligibility, medication access, and funding that will fundamentally reshape HIV care across the state. These changes take effect March 1st, 2026, leaving consumers with just 2 months to find alternative coverage. Here is what you need to know. First, direct access to ADAP-provided HIV medications will be limited to individuals at or below 130% of the federal poverty level, the sharp drop from the current eligibility limit of 400%. For 2026, that means just over $20,000 for a single person and roughly $27,000 for a household of 2. Anyone earning even $1 more over the cutoff will lose ADAP-provided HIV medication coverage, regardless of clinical need. Second, ADAP will continue covering medication copays for insured clients up to 400% for the federal poverty level, but ADAP-funded insurance premiums will be eliminated. Consumers who relied on that support will now face full costs of coverage, and many may lose insurance entirely, along with access to providers, lab work, and ongoing care. Third, ADAP is moving away from certain single-tablet antiretroviral regimens. Biktarvy will be removed from the formulary, and Descovy will be restricted to individuals with documented renal insufficiency, with the state signaling that further changes may follow. Fourth, the ADAP rebate model will be eliminated, reducing funding for staffing and critical operations statewide. According to the National Alliance of State and Territorial AIDS Directors, Florida ADAP served over 32,000 clients in 2024. Roughly half of all clients earn between 138 and 400% of the federal poverty level and are now at immediate risk of treatment disruption. This is not a simple policy change. It is a life-altering disruption that threatens viral suppression, public health progress, and the stability of thousands of working Floridians who depend on uninterrupted HIV treatment. Look, first I need to say this. We all know I work for Holy Cross. This has no way, I can't speak on behalf of Holy Cross on this, as well as I am the vice chair for the HIV Planning Council, but I'm not authorized to speak on behalf of them either.